Welcome back, everybody, and we're now moving to our next session, again continuing wider perspectives on prevention. I'm going to call first to the podium and we'll introduce our panellists as they go through, as they are ready to present. So Professor Breda Smyth, who some of you may know is the Chief Medical Officer based in the Department of Health, I'm going to give you a public health perspective on the whole issue of prevention. Thank you, Breda.
Thanks very much, Paul, and hello, everybody. My name is Breda Smyth, and I'm the Chief Medical Officer. I'm here today because drug use is a significant public health problem in Ireland. After I graduated, when I was deciding to specialise, and what I was deciding to specialise in, I did a 6-month clinical job in infectious diseases. At that time, I had worked in Africa on voluntary services abroad, and I had witnessed abject poverty. I had worked in New York while on a J1, where heroin addiction was rife. However, the greatest culture shock I experienced in my life up to that point in time was this infectious disease job in Dublin. This was Ireland, but I was experiencing a completely different language. People were talking about FI and the joy, all terms I'd never heard about before. It was a completely different environment. Children were stealing to smuggle drugs into parents in prison, in hospital. Sexual assault at a young age was common. There was physical assault. There was also prison sentences in the Mountjoy, and this was very common. It was a different perception of normality, and it was certainly a different perception of normality that I was accustomed to in the west of Ireland at that point in time. I realised that health was not just about the health system, but it was also about the wider determinants of health. It was about education, housing, employment, nutrition, parenting, and also security. I chose to specialise in public health after that, and I went on to do a postdoc fellowship in UCLA in drug abuse research. So many of you throughout the Assembly will have heard the lived experience that has been shared with you. Shannon, a young girl from the travelling community, Fionn, whose mother died at age 22. We know now that the profile of drug users in Ireland has changed significantly over those 30 years. Drug use can affect us all, from all social classes and from every county in Ireland. But it affects those more severely in deprived areas. The harmful impacts of drugs on public health are many. Substance use is responsible for a considerable number of premature deaths. There are 409 drug-induced deaths in 2020. Every drug death is a family devastated. Drug-related hospitalizations account for approximately 53,000 inpatient bed days each year and over 200 day cases. 70% of our hepatitis C cases are IV drug users, and the risk of HIV is 25 times greater in IV drug users than the general population. There's also increased risk of HIV and Hep C linked to injection of stimulants such as amphetamines and cocaine, and this is because of the increased frequency of use and sharing of injecting paraphernalia. Mental health is also a significant problem associated with drug use. Dual diagnosis is well recognised, and also there's the coexistence of mental illness and drug use. There's also been a steady increase in our admissions to psychiatric services associated with drug-related causes over the last decade and a half. The data available on cannabis use is of great concern. 1 in 5 adults who use cannabis are likely to have a dependence on it, and 1 in 3 young people likely to become addicted if they use cannabis weekly or more often. The strength of cannabis and its potency has increased by 57% in the 10 years from 2011 to 2021. Also, the profile of cannabis use has changed over time, and people are using it more frequently, many daily. Cannabis can cause addiction. We have 45,000 people with cannabis use disorders in the latest data. And in 2022, the HRB report that our under-18s account for 80% of new presentations to our cannabis addiction treatment services. Hidden harm is the experience of children living with and affected by parental problem drug use. Children suffer harm in a number of ways as a result of compromised parenting, which can affect the child's social, physical, and emotional development. The latest drug treatment figures available show that in 2022, almost half of cases in drug treatment were parents. Here you can see how on the pathway to problem drug use, different factors come into play at different stages. When someone starts using drugs, the key influencer is their environment, their perception of normality. What is normal to them? What is normal at home? What is normal in their community? However, when a person decides to continue in their drug use after their first experience, personal characteristics become a stronger influencer. But we also know that our personal characteristics are informed by our formative years at home, by our environment, by our community, by our networks. It's only at a much later stage do we see the pharmacological effects of a drug become influential in predicting problems with drug use. So when we think about this, the perception of normality, it's the influence on the pathway of substance use. Legalizing a drug and increasing its access is a form of normalization, and thus will change the perception of normality. It decreases the perception of risk associated with drug use. So the next 3 slides are based on our health-led approach, which involves a primary, secondary, and tertiary prevention. Every public health doctor will tell you prevention is better than cure. And I agree with that, and this is also true for drug use. I'm not going to go through all these programs because I know some of my colleagues already have touched on some, have introduced them all to you with our secondary harm reduction programs and also our recovery programs. And I know Paul will be ringing the time bell, so I don't have the time to go through them all with you. But what I will talk to you about next really is how do we engage people who use drugs with this health-led approach. It starts early with our home environment, our friends, our colleges, our communities, and our organisations. But we also know now that the profile of our drug users have changed since the 80s. Over a third now are cocaine users, and we have a third opioid users. In 2022, cocaine use increased by almost 26% from 2021, that's in 1 year. So we need to adapt how we engage with drug users to ensure they engage with our health-led approach. Stigma acts as a barrier to those who wish to seek treatment, so we need to change the narrative regarding drug treatment. The Health Diversion Programme is a very good example of changing our narrative and the diversion from the criminal justice system to our health programmes. These schemes represent a vital link for the person who uses drugs to the health services and a potential path to recovery. And these schemes are also have a greater impact in deprived areas.
Just less than 2 minutes, please, Breda.
So our health system reform, Sláinte Care, gives us the opportunity to give the right place in the right care in the right place at the right time. And this also should apply to our drug treatment services. The development of our new RHA, Regional Health Structure, is an opportunity to provide drug services at a regional level on an integrated basis. It is the opportunity for better integration between primary care, mental health and social inclusion services, but also including local authorities in the discussion and the seamless integration into the wider determinants of health at an RHA level.
1 minute, Breda.
I'd like to bring you back now when we talk about the public health implications of drug legalisation to one of my earlier slides. When someone starts using drug, the key influencer is their environmental factors, their perception of normality. What is normal? So legalisation will increase use and the normalisation of drug use. So what is the peer-reviewed evidence telling us from other jurisdictions that have legalised drug use? Well, from Ontario and Canada, data from 2001 to 2019 tells us it increases the prevalence of cannabis use and the profile of the use to daily use. It increases also the prevalence of cannabis-related problems, including ED admissions and hospitalizations. A 2021 research article that focused on adolescent cannabis use concludes that high and low frequency cannabis usage are associated with significant increased risk of schizophrenia.
I have to ask you to finish, Breda, please. Sorry, no.
So finally, there's no silver bullet. We need a multi-layered public health approach with primary, secondary and tertiary prevention. And also in public health, we base our decisions on evidence.
Thanks, Breda.
Thank you.
Do have finished. Thank you very much.